Right, audience, wave to the camera.
Hi, Kim.
All five of you. All right. Hello and good evening. I am Brianna Bliss. Before we get my little speech on the roll, I just want to take a quick, show of hands. Who on here thinks that physician-assisted death should be legal? Oh, okay. Yeah. Okay. So most of you. Well, I didn't think that it should be up until recently. So I had a event in my life that kind of changed my mind on it. I kind of thought it was unethical until about March of last year when my grandmother got diagnosed with pancreatic cancer. So I watched her battle cancer and lose, and that was kind of my big turning point in my life, thinking, okay, there might be something behind this. So today in my speech, I will kind of tell you my story about kind of what happened to my grandma and how she battled cancer. I will tell you exactly what physician-assisted death is, kind of who qualifies for it, the process of it. I'll go into kind of what other countries have in place for their physician-assisted death programs, and I'll talk about some of the counter-arguments against it as to why it should stay illegal. So with that being said, let's jump on into my story about my Nana Marilyn, who again is my grandmother. Back in December of last year, she got diagnosed with pancreatic cancer. At that time, they thought she had about 6 months to live. A few further tests and scans showed that it had spread pretty much everywhere, and that 6 months got cut to about 3. Come March, I went down to North Carolina to be with my mother and my grandmother in her last few weeks of life. Pancreatic cancer is one of the most painful cancers, if you don't know that. So by the time I had gotten there, my grandmother was essentially begging for death. North Carolina does not have a physician-assisted death program. It is illegal there. However, my mother is a nurse, so my grandma was looking to my mother, who again is her daughter, saying, please just overdose me with my medication. Like, she was in that much pain. She was miserable. She could not move on her own. She couldn't utilize the bathroom on her own. She couldn't bathe herself, could barely talk or eat. It was a really, really, really bad situation. Got to the point where her last 2 weeks of life, she literally laid in the bed and did not move, did not talk, did not do anything except for get drugged up on medication. Watching this strong, independent woman who I looked up to my entire life go from being that strong, independent woman to not being able to take care of herself, not being able to talk, not be able to do anything because of this cancer, and watching her suffer for weeks more than she really needed to. It was hard. It was hard on all of us. It was hard on her. It was hard on me. It was hard on her husband. Everyone involved, it was just awful. So that was really my big, okay, physician-assisted death might have some theory behind it if it's negating this and making that this isn't a thing. So I didn't really know too much about physician-assisted death, though. I was under the impression that it was kind of like euthanization, that a doctor just injected you with a medication that killed you, and that is not the case at all. So physician-assisted death, which I'm going to henceforth for the rest of the speech be referring to it as a PAD. So PAD is actually a process where it is a prescription medication that your doctor prescribes to you, and then you yourself take it. It is, according to the Death with Dignity website, it is 100% pain-free, completely humane, and it is a very, very peaceful way to essentially pass on. The patient will fall asleep within 20 to 30 seconds and be dead within about 30 minutes. So it's very peaceful. So Death with Dignity kind of did a bunch of stats about kind of what states have a program for it. And as of April 5th, 2018, there's 5 states that have a PAD program in place. That's California, Colorado, Oregon, Vermont, and Washington. Hawaii just passed a law this year, so as of 2019, Hawaii will have it as well. And there's actually 22 states that are trying to get some type of PAD program in place. So there's actually bills in legislation trying to get passed. So it's becoming a more widely accepted and known thing, but I still feel like there's a lot of controversy behind it, just because I feel like a lot of people don't know really what it is. Just because, again, people think that it's murder, that the doctor's killing them, when really it is them killing themselves. But it's only under certain circumstances. So going into that, the Death with Dignity website, again, talks about kind of the program. So Death with Dignity is actually Oregon's program for PAD. And essentially, there is a lot of things in place to make sure that this program is not abused. So you have to be over the age of 18. you have to have less than 6 months left to live, like be medically diagnosed with some illness that has made it so you only have 6 months left to live. And you have to be mentally competent. So that meaning you cannot have depression, you cannot have anxiety, you cannot be suicidal. And you will go through a psychiatric evaluation if your doctor feels that you are these things, and if you are, they will not give it to you. They only give this medication to people who are mentally competent and who've asked for it multiple times as well. You have to verbally request it at least twice, and there has to be a 2-week period between each verbal response, and you have to write it down once. So it takes about a month to get this medication. It's not like you can be told, hey, you have 6 months to live, and you'd be like, okay, give me that medication now. Like, that's not how it's going to work. There's a bunch of things in place to make sure that this is actually the decision that you want to do. So there's a lot more that goes into it than more people would think. Some of the stats provided by the Center of Health Statistics on Death with Dignity kind of go through who utilizes it. So about 76% of the people who end up using this prescription medication have cancer, have terminal cancer. 6% have cardiac or heart disease, and then the rest is just kind of liver disease like AIDS or, kind of lesser known terminal illnesses. 80% are over 65, the median age being 74, So most people who are using it are older anyway. It's not like it's 18-year-olds taking this medication all the time. Most of them are educated as well. 50% had a bachelor's degree or higher. And what most people said, reasons why they wanted it, was the decreased ability to be able to do things that they enjoy, the lack of dignity, and lack of independence. So 87% said that they wanted it because they couldn't essentially survive on their own. They couldn't take care of themselves. And 67% said it was for the lack of dignity. People having to essentially clean up after themselves. So, going into that, what other countries have these programs in place? So there's actually 5, I believe. The Netherlands, Belgium, Canada, Colombia, and Switzerland all have some type of physician-assisted death program. Switzerland is the biggest one that most people know about. Essentially, for Switzerland's program, the My Death, My Decision website talked about how it's essentially the same thing. Like, you have to be over the age of 18, mentally competent, and be suffering from a severe illness. However, in Switzerland, it doesn't have to be terminal. So essentially, if you have dementia and you are losing all your memories, and it's not going to kill you, but you're not going to remember half your life, you can go and get this PAD and end your own life. So, however, with Switzerland's program, it usually takes up to 3 months to get the medication, and it's very costly, especially for people coming outside. So Switzerland is the only country that allows people who aren't residents of Switzerland to come in and get this done. But it costs upwards of $11,000 to get it done. Yeah, it is very costly to die. So that's what it's like in other countries. So there is, other places that it has been successful in. As I'm going to roll into kind of the counter arguments now. Obviously, it's a huge controversial issue. A lot of people have a lot of opinions on it and what it should or shouldn't be. Some of these being, it's just an issue of ethics. So according to Ethics in Medicine, an article by Dr. Burdock, a lot of people, they did a poll to kind of see why people were against it. One of the biggest reasons was sanctity of life, which is essentially a religious viewpoint. It was more like the religious people said, if you do this, it's going to diminish the sanctity of life. I feel like it's not going to mean as much. Apparently. I don't know. Either that or they just think it's suicide, you're going to go to hell. I don't know. So that was one of the biggest reasons. One of the other reasons was people saw it as a potential for abuse, which granted it could be there, but going further into that, they were saying that they think people who can't afford life-saving healthcare are just going to decide to do this instead, and that their family members are going to push the ill person into it for cost reasons. However, if you think about Death with Dignity, they're terminally ill. They have to be terminally ill. So if there's a cure for it, you can't get it. You can't get this medication. So that kind of gets that off the board. And like I said, to go to Switzerland, it's upwards of $11,000. So if you can't afford to get yourself treated, chances are you're not going to be able to afford the medication either. So I mean, granted, there still probably is a little bit of potential for abuse, but there is practices in place to negate that and make it so that's not actually a thing. So the American College of Physicians wrote an article as well. And they essentially argued that it goes against a doctor's purpose to preserve life. They also mentioned that a doctor's purpose is also to relieve and minimize suffering. So they kind of acknowledge that, yeah, I think it's to the point that we can't save your life. At least at that point we can minimize suffering. However, at the end of their paper, they did say that, according, again, the American College of Physicians, they are against it, just claiming that there's too many ethical, clinical, and other concerns, claiming that death should be less medical. They don't want people essentially going to their doctors to die, essentially. So the counter arguments are very valid. I'm not trying to sit here and say that they don't count at all, because they very much do. However, there will always be controversy surrounding issues, especially issues with death. However, we all are going to die eventually. I, for one, would like to know that if I'm going to die, especially of like a terminal illness that I'm going to suffer from, that I at least have options available to me to end it, so I don't have to put my family through what, I watched Nana Marilyn go through, so I don't have to have my loved ones go through that as well. And so I don't have to go through that, because I don't want to go through that. If I get to that point, I personally wouldn't want to. So this is going to bring my speech to an end. Most of you were for it, but I hope those of you who are against it learned a little bit more and maybe swayed to the other side, and hopefully those of you who are for it kind of learned a little bit more about it. Just to kind of recap, today I covered kind of my story that changed my view on physician-assisted death, what physician-assisted death really is, what other countries have in place for it, and some of the counter-arguments for it. Well, against it, I guess I should say. But that is my speech. Thank you for listening.